day everyone, I am pharmacist Adesina Rebecca, and today we'll be discussing on the topic fever. Fever, medically known as pyrexia or akatemia, is a physiological condition characterized by abnormal increase in body temperature. It is an indication that there is something out of ordinary going on within the body system, some of which can be as a result of illness, diseases, the body trying to boost the immune system, or the body trying to fight against the pathogens present within the body, and so on. According to WHO, the average normal body temperature is between 36.1 degrees Celsius to 37.2 degrees Celsius. So once the temperature is above 38 degrees Celsius, fever tends to occur. The action of the hypothalamus is influenced by factors like infections such as bacterial, fungal, viral, presence of cancer, case of hormonal imbalance, and certain conditions like heat stroke. Based on duration of action, fever can be classified into acute, subacute, and chronic. The acute type of fever is a fever that lasts less than 7 days. The subacute lasts between 4 to 14 days, while the chronic lasts between more than 14 days. The chronic fever lasts more than 14 days. Based on pattern of fever, fever can be classified into intermittent, remittent, relapsing fever, constant fever, and continuous fever. For the intermittent, the pattern of fever fluctuates between normal and above normal within 24 hours of taking the temperature readings. For example, it can be 37 degrees Celsius at one time, then 39 degrees Celsius, then 38, 37 degrees Celsius within 24 hours. And type of fever. For the remittent type of fever, the pattern of the body temperature reading usually fluctuates between abnormal and abnormal, that is, does not usually go back to the normal body temperature range. For example, it can be 38 degrees Celsius when taking this for now. In the next 4 hours can be 39, 40, 38 degrees Celsius. It does not go back to normal body temperature. And this can be seen in cases like cold and influenza. The intermittent one, in case you can see that such case in terms of malaria. My advice to people out there is to try to have enough rest, drink a lot of fluid, take a warm bath before taking any fever reducing agents. And if after 1 or 2 days of taking this fever reducing agent and there is no difference, you should consult your pharmacist. Note: in some cases, fever is usually associated with symptoms like abdominal pain, nausea, vomiting, loss of appetite. This calls for prompt attention. But in cases where your fever symptoms is associated with hallucinations, dehydration, neck stiffness, there's need for emergency attention.